Ladies and gentlemen, Professor Marc Noppen.
Thank you. Hi, everybody. Now you know who I am, Marc Noppen. And I've been given 10 minutes or so to talk to you about the difference between sick care and health care. And I guess you're seeing now an old painting, is that correct? Okay, because I see two images here. I have the privilege to teach to medical students, and I teach to them in their 4th year, when they are already almost thinking that they are doctors. I'm the first one to show them this picture, which is called The Doctor. And the doctor in this picture is the elderly gentleman sitting next to a dying child. And why do I show this picture? Because it was painted exactly in the year that my grandfather was born, 1897. And he could have been that dying child there. And then ask my students, what is the life expectancy in 1897? If you are born then, how old do you get? I'll give you the answer, it's 42 years. Then I show them this picture. It's a picture of today's medicine. And we can do tremendous good things now. We can really make a difference. And then I ask my students, what is the life expectancy today when this picture was taken in my hospital? The life expectancy is 84 years. We went from 42 to 84 in 2 generations. This has never happened before in mankind. And then I ask the students, how does this happen? What did we do? And what the students always start with is this. It's us, the doctors, handsome doctors, on top of that. But, Superman. But in my student audience now, the majority of students are girls. So it's also super women that make the difference. But I have to disappoint them. We make a difference, but it's relatively small. What determines your life expectancy? And if you look at healthcare, it's only about, let's say, 15% of this doubling of life expectancy is thanks to what we as doctors did. The rest is society, clean water, sewage, good food, good jobs, healthy food, no wars, stuff like that. Social security. That's the main leverage for the doubling of your life expectancy. So I'm a big advocate of the concept of health in all policies. Health should not be just in the Department of Healthcare. It should be in everything. The best proxy of your life expectancy is your postal code. That's where it comes all together. A research group of our university has shown that if you look at this complex graph, that the relative risk of death on the y-axis and on the x-axis, you see the relative risk of poor health, and you see a linear relationship with education level and the profession that you have. This is just one example. It's your profession and your education status. I would like to show you this graph. From 1980 till now, you see a rise, it's the gray lines, that is the USO countries, the Western countries. And you see an increase in life expectancy. And you see various things on this slide. You see there is the drop at COVID. That's at the right-hand side of the slide. You see this little drop in the USO countries, the Western countries. You see a huge drop in the United States. And that says a lot about the health of the American population. And I cannot stay silent about the importance of society and politics. And you see here the American situation, and I will not go into politics, but you see the blue Democratic counties and the red Republican counties, and the impact of COVID and vaccination, etc., in this continent. And it's amazing. So the role of society is very important. But on the graph where you see other things, you see that from 1980, the slope of the increase in life expectancy in the States has come down a bit. And from 2010 onwards, you see a flat level. Life expectancy does not increase anymore in the United States of America. And the big culprit there is food. The proportion of ultra-processed food eaten by American citizens approximates 85%. 85% of their food is ultra-processed. It's not even processed, it's ultra-processed. And this is a tremendous burden on the health of a whole population. But we don't have to be too proud in Belgium because our situation, I don't know if you can read this, but we are not in the best areas. And you see this concept of Mediterranean diet, the blue dots around the Mediterranean, they almost never eat ultra-processed food. And we do. Another statistics is, for instance, the calories, the number of calories that you take. And you see there, of course, the US of A, number 2 in this, but Belgium, number 3. I didn't know that. This is what amazed me, is that the healthcare expenditure in Belgium or in the usual countries due to a lack of physical activity, and you see the second worst country is Belgium. Malta is even worse. But we are lazy people in Belgium. Whereas we all know that physical activity has a tremendous impact on your global health. But if you are the worst student in the class, then there's the biggest room for improvement. And we have seen that during COVID, during the lockdowns, Belgium was champion in the increase in physical activity of our population. Do you remember the lockdowns? We only could walk and bike outside with the dog, and we couldn't do anything else. This has helped us a lot. I'm running a hospital with 700 beds. Half of those beds are filled with people who are there because we treat them and we love to treat them, but they are living there because of a year-long or even decennia-long bad habits. Still smoking, reason number 1. Cholesterol and blood pressure, it's complex, it's multifactorial, but low physical activity, bad food, a lot of alcohol, etc., are the main reasons. And the volume of these bubbles show the reasons why the people are in my hospital. And that has nothing to do with medicine. That has nothing to do with health science. It has to do with behavior, with attitude. Now, I still want to run a hospital where we can use all the technologies and techniques that we have today to cure sick people. But because of the demographic evolution, and because of the cost, the increasing costs, and let's say the limited resources that we have, we are touching the limit of the system. So my point is, if I want to keep running a good hospital, that I have to decrease the number of patients that I can treat well. So we should look for a new equilibrium between sick care, what we are doing today. I'm not doing healthcare, I'm doing sick care, versus healthcare, and that is health promotion and prevention. Because, as Michael Porter said, the days in healthcare, days of business as usual are over. And I would like to close with, to put some action to my words, is that we are starting, as of today, a program in our hospital. You know, I'm working at University Hospital Brussels. A hospital is a ziekenhuis, a sick house. And we are starting a project, University Health House Brussels, where we start a comprehensive program, starting from genetics, microbiomics, and you can go on, with 100 personnel of our hospital as a pilot study, thanks to our foundation, and where we will follow them up scientifically and try to prove our point, because I heard it in a previous session, what is lacking sometimes is the speed by which the classical academics follow what is happening in this world. So we want to give the example. And we will start this as of today. Thank you for your attention. Thank you.
Thank you very much, Professor Dr. Noppen.